So Stephanie is going to present to us. She's the director of the Humanitarian Program at Airlink. I've worked with Airlink in the past, and they are a really, really interesting model and asset for the humanitarian sector. Stephanie leads operations connecting NGOs and the aviation sector to deliver disaster responders and supplies in the wake of humanitarian crises worldwide. She joined the Airlink team in 2013, and in her first 2 years at Airlink, she helped the organization double the logistics cost savings it delivers to NGOs annually. Today, she leads a team of experts that help nonprofit organizations transport passengers and aid cargo to emergencies around the world. Those of us who have worked in some of the organizations that Gareth referred to, smaller, more nimble NGOs, this kind of logistics support came in very, very handy. So with that, I'm just going to hand over to Stephanie. We're really looking forward to your talk.
Super. Thank you, Mariana. Good afternoon, everyone. Good morning to those of you who are on the same side of the world as me. So I'm here to talk to you today about our COVID-19 response and sort of the private sector partnerships that have amplified it. So I'll talk a little bit about Airlink, of course, and as well as one of the partners that really amplified our work through an innovative funding partnership over the last year. So I'll talk a little bit about what that looked like in practice, both for the organizations that we directly work with, as well as the people we and they serve, and what we've learned about successful partnership as a result of that. So at the onset of the COVID-19 pandemic, really brought to light systemic issues in the global health supply chain that affect timely delivery of essential medical aid, including both emergency and primary care that affected vulnerable populations everywhere. The humanitarian organizations across the world are really already accustomed to operating in constrained environments. We know that Syria, Iraq, Yemen are great examples of that today. But COVID-19 presented a really new landscape of supply chain disruption, and it created a really challenging environment in which to deliver services that help communities in crisis. So the case study I'm presenting today is a successful example of collaboration between humanitarian and logistics sectors to overcome sort of logistical challenges of delivering essential aid during the pandemic. And I'll highlight the experience of Airlink's Aviation Cares initiative, as well as the support we've received from one specific funder. So for those of you who aren't familiar, just allow me to start with a little bit of background about Airlink. Our organization is a registered nonprofit in the United States. Our work is worldwide, though. We're a partnership-focused organization, and there are some of the partners there on the screen. Our mandate is really to break down the logistical and financial barriers to entry for nonprofit organizations responding to emergencies around the world. So we do this by working with one actor that clearly has a global footprint, commercial aviation. So when prices skyrocket in disasters or an area affected by an emergency is really difficult to reach, we work with airlines like the ones that are also on the screen to help more than 130 nonprofits serve people in need. So the normal supply chain in emergency, where health is a key need, normally involves all the steps on the screen: funding, procurement of supplies, shipment of those supplies, and access to healthcare by the people who are affected by the emergency. This is an already challenging system to navigate in an emergency, but it really fell apart at the outset of the pandemic. So over the last year, those sort of unprecedented supply chain issues affected both high income and low and middle income countries alike. There was more need around the world than there was funding able to assist. The health supplies market was absolutely flooded with procurement requests, and supplies in hospitals around the world continue to dwindle. More than 90% of the global passenger air capacity was taken out of operations. That's belly space, cargo. At the same time, demand for freighter flights went up by as much as 500%. So that really constrained the global movement of supplies. And then as people were told to avoid hospitals unless they had severe COVID, and normal supplies like oxygen and medications for chronic conditions ran out, access to routine healthcare dropped off. So we're seeing this around the world right now in places like Ecuador, Brazil, and most acutely in India. So This on the screen here is just a quick snapshot of the work we did over the first year of the pandemic. So we developed and executed on a dynamic distribution mechanism to support responding NGOs around the world. We started this back in February. This mechanism is still working today, and we're leveraging existing capacity of the commercial aviation sector in order to send PPE, medical supplies, and hygiene materials to communities impacted by COVID-19. This effort was dubbed by our communications team Aviation CARES. CARES stands for Coordinated Air Response for Emergency Supplies, and it's been executed in partnership with our nonprofit partners who focus on providing medical and other supplies, as well as Airlink's freight forwarding partner, Flexport, who I'll be talking about today, and Airlink's global network of air carriers and aviation donors. This is just the map of 1 year. From our first shipment in China through to, I believe it was a couple of shipments in sub-Saharan Africa in January. We're still obviously sending supplies, PPE, testing materials, oxygen supplies, and other diagnostic tools around the world, as well as general medical supplies to countries who need it, and specifically countries in West and Central Africa, those affected by conflict in the Middle East. And now, as I said, most acutely in India. Ultimately, our COVID-19 response has served to ensure continuity for our NGO partners' health programming. Our first goal, obviously, has been to respond to outbreaks by supporting flights for PPE and medical supplies, as well as for healthcare workers in some situations. As the pandemic continued on from February and March into April, we really started to move into support for healthcare systems, working to rebuild programs that were paused due to lack of air access. And now we're also working with NGOs to help bolster vaccine campaigns, mostly in the US, as we are a US-based organization, but also in sub-Saharan Africa. And we hope to see those programs grow in the future. In the midst of all of this, of course, there are natural and man-made disasters, and those continue to pace, and they were also exacerbated by the pandemic. But we were there to help. So I mentioned them before, but I want to talk a little bit about Flexport.org, who's the donor that worked with us over the last year and really amplified our work. So Flexport.org is the corporate social responsibility arm of a global freight forwarder, Flexport. Freight forwarders are sort of that linchpin between organizations that need to ship supplies and airlines and the way they're carried around the world. So just like us, they're really focused on helping aid agencies move supplies in emergencies, as well as sort of working on their business as usual needs. In 2020, they stood up the Frontline Responders Fund. Ultimately, they raised $10.2 million US to fund COVID response in light of the compromised supply chain I talked about. And Airlink has received more than $600,000 in grants from this fund. So I'll talk a little bit about why that's so important. It's not just funds. So I'll talk a little bit about why that partnership is so revolutionary as well. So over the course of our partnership, which started in 2018, we've worked with Flexport to move more than 70 shipments around the world for a wide variety of disasters and man-made crises. Much of that activity has happened in 2020, as you can guess. But what makes this partnership really special is that Airlink provides free airlift and Flexport provides discounted logistics services. So prior to the pandemic, in most cases, this combination of donated and discounted services brought the cost to move a normal shipment via air freight to any given disaster from about $1,000 to $5,000 US, depending on the size of the shipment and the specific needs involved. But with the help of the Frontline Responders Fund, we've been able to bring that cost down to zero. So that's helped our NGO partners redirect the funds they would otherwise spend on air freight and logistics to programs that reach more people in a time when funding is one of the most scarce resources. So in practice, what does this look like? There are lots of case studies on the screen. I won't sort of read through all of them, but I will just talk about a couple of really big successes. So in June of last year, Southern Africa was really seeing the effects of the pandemic. And in Botswana and Namibia, two local NGOs that we work with had identified a significant need for hand washing supplies. simple ones like soap. And that really was going to help prevent the spread of COVID-19. And so Airlink got to work. We brought on support from Qatar Airways and Flexport.org to move about 500,000 bars of soap. For context, that is about the weight of 4 semi-trucks. To move that soap to Namibia and Botswana, and saving the NGOs more than $500,000 in air freight, trucking, and customs clearance. And the other example I just want to talk about, I talked about the fact that disasters continued. The biggest one that happened last year was obviously the explosion in Beirut. So we partnered with Flexport, again, on a pretty large scale there. The health system was really on the brink of collapse before the explosion. So when the explosion did happen, medical supplies were really needed quickly in order to help contain COVID-19 and serve the new and existing needs. So all told, we worked with about 12 local and international nonprofit organizations to provide free airlift for 40 tons of medical supplies. Thanks to the Flexport First Responders Fund, plus the donated airlift we secured from our airline partners, we were able to save NGOs more than $284,000 US in logistics costs. And that's funding that we know from our monitoring and evaluation was used to bolster in-country programming and then eventually purchase more supplies locally when they became available. So through all of this, as a partnership-focused organization ourselves, here's what we know, and here's what's been reaffirmed over the last year through this innovative partnership. There are a few key components of a successful partnership, no matter who it's with, and these sort of 5 points here have worked especially well during the COVID-19 response. The first is mission alignment. So as I said before, shipping aid to communities in need is a core part of the Flexport.org mission, and it's also our mandate. So it really goes to show that private sector and civil society actors can share a common goal and empower each other. As a sector, we've really gone from just coordination, just working not to step on each other's toes, to collaboration and really working alongside each other in a way that's really constructive. The second thing is operations coordination. So we work really closely with my team really works closely with Flexport.org we convene every week, once a week, to review every shipment and ensure aid is delivered on time. Third point that we feel was really important is leveraging technology. So working with Flexport's allowed us to gain supply chain visibility and control. We work on their cloud-based platform to ensure transparency across all the parties that are involved in every shipment. But we also use that data along with Flexport.org to help us improve our processes continuously. The fourth item is leadership involvement. And this may not seem like a big deal, but we really believe multi-level engagement is key to a smooth working relationship. So the senior team at Airlink, as well as the senior team at Flexport.org, are in regular communication. And our CEO actually even hosted an episode of our Flight Path podcast with the head of Flexport.org. And then finally, the thing I've been here talking about today is an innovative approach. So obviously, Flexport.org granted us some $625,000 over the last year. That's helped us make strides in partnership with 5 airlines we'd never worked before. And it's been really a force multiplier. We've turned that $625,000 into more than $3 million in transportation savings, which is about 5x return on donated dollars for those of you who it's too early to do the math. And that's all I have for today. Thanks so much to the coordinators of the Humanitarian Leadership Conference for having me. And my contact information is there on the screen.